Now to answer some of your medical questions, and joining us to explain all of them, News Channel 5's medical specialist, Dr. David Soria. He's the chief of emergency medicine at Wellington Regional Medical Center when he's not here with us. Thanks for coming in.
Good to see you.
Good to see you. This first question, a bit sticky, a bit embarrassing. This viewer wants to know, when you're shaking someone's hand, is there any kind of a surgical procedure that you can have to stop having such a sweaty palm?
Yeah. You know, you think that's a little drastic, don't you? I mean, a surgical procedure for sweaty palms. But if you're one of the few or the many that actually suffer from that, it's a small price to pay to get some relief. So typically in the past we've used other things, non-invasive things, topical antiperspirants. Limited success. We've even injected Botox into the area and used oral anticholinergics, which have a lot of side effects. Not real helpful, still a big problem for some of these people. Now there's a new procedure called endoscopic thoracic sympathectomy. Very interesting. Thoracic surgeons go into the chest cavity with a camera, with a scope, and they clip or snip or clamp the nerves that are responsible for causing those areas, the hands and the axilla, the armpits, to sweat. And so it is with a 98% success rate, and people swear by it.
Is that considered a major surgery?
It is minor. You have general anesthesia. You're out that day, and you're doing your thing the following.
No kidding.
It's a pretty amazing procedure. So if you're one of those, I would highly recommend, at least encourage you to take a look at it.
Absolutely. Okay, good information there. Our next question, we've been reporting on, this has made the headlines in the past week or so, and we've reported the story. Is it true or a myth that working long hours can lead to depression?
Yeah, there's been some new studies on this, and some of us might say, well, real breakthrough, right? You work real long hours, you're not going to be real happy. But the reality is there is some science behind it. And what they found, what they found was that if you worked 11 hours or more, you're 2.5 times more likely to have a major depressive episode. Now, that's much more severe than just being upset at your boss. So we cited three really,
You're talking like clinical depression here.
We're talking absolutely, meaning it is debilitating, meaning it affects your life, and you can even be suicidal.
Oh my.
Okay, that's a major depressive episode, not just upset that you're working long. Conflict with family and work is a contributor, and also what was found was that your cortisol levels are increased, which is your stress hormone, and that can also lead to health problems such as hypertension. So much bigger problem than just feeling bad. So definitely gives you that that excuse you've been looking for to go to your boss and demand shorter hours.
Well, and it's just all about striking that balance, right? Getting that balance.
Always.
Life depends on it.
That's right. So that being said, I think it's quitting time. Right?
Well, on that note, we will let you go. You can quit for this segment.
Thank you.
Thank you for coming in, Dr. Soria. If you have a question for him, just hit our website, WPTV.com, and you'll find the link. We'll be right back after this.